So next up, to continue our journey, we have the wonderful Neha Raukar. Neha is an ED consultant at Mayo Clinic, and she is also the medical officer for the US ski team. Her daughter Zia is down the front and already starting the enthusiastic applause. She speaks all around the world about concussion, and she's going to be speaking about seeing stars, concussion. Neha was also a food critic for 5 years in DC. So not only is she fantastic at treating kids, but you might actually ask her where you'd take someone out for a treat. Thank you very much, Neha.
Thanks, Grace. Thank you very much, and happy birthday to Chris, who is a Packers fan, and we'll talk about that. So, because there are problems. So, so I'm going to take billions of dollars of research that we've done in the United States on concussion and bring it here across the pond to give you all sort of an evidence-based starting point to talk to our patients. And maybe some script also to talk to our patients, because I don't know about this side of the pond, but where I live, basically if you come to the emergency department and you've hit your head, you're being diagnosed with a concussion, right? And we'll let the specialists figure it out later. So we're going to talk about what they do and how they do it. All right, so this is a problem in the States, as we know. So we're going to talk about risk, diagnosis, and recovery. All right, so we can't really escape this topic. We try, but every time you turn the TV on, you turn on any sporting event, even in politics, and on my flight here, they had the favorite section of the movies, and Concussion was like third. And that came out years ago. It should have been Endgame, not Concussion. And that's science fiction, but that was the third most popular movie on the flight on my way here. So we've talked about it, we're talking about it all the time. So we say that the risk of concussion per year of sport in youth athletes is about 20%. And that's sort of an underestimated report because we know that this is an underreported disease, right? We know that in athletes, if somebody hits their head, they want to continue playing. They're not going to report their disease. So we did some studies. Do you ever suffer but continue to play through your head injury, through your concussion? And this is boys versus girls. And the numbers are fairly similar, but shocking, right? Like we see so many kids, 70% of women, almost 80% of boys, knowing that they have a concussion because all the youth athletes are educated on this, knowing that they have a concussion, will continue to play because they have state championships or nationals coming up, and they want to play. They don't want to be removed from sport. And so here's what we have to deal with. Why don't you report your symptoms? And we have a broad array of reasons people don't report their symptoms. But basically, it's the culture in the locker room, right? They don't want to be seen to be weak. They want to keep playing. Maybe their parents are pushing them to keep playing, and they want to fulfill the dreams of their parents. Maybe they don't understand what a concussion is. Maybe there's a lack of resources. But there are a variety of reasons why kids don't report their symptoms. So how often does it happen? When we talk about concussion, we talk about trauma, we talk about injury, and we spend a lot of money talking about sports-related concussions, right? I mean, that's where all the research is. But in fact, sports-related concussions is a very small part of all the concussions that happen. In fact, most happen due to falls, motor vehicle accidents, and trauma, assaults. So even though we learn so much about concussions from sports, and of course, it's a finite space. The playing field is a finite space. It's a great test tube. We know those kids are going to get hit. We know they're going to have a concussion. We love to do studies on them because we know they're going to have an injury. So it's an easy test tube from which to draw evidence. So let's talk about the rates in the US first. So we'll talk about youth athletes. So we know American football has the highest rate of concussion for boys. For girls, it's soccer. And not only is the highest rate of concussion for girls in soccer, that's the second highest rate in all of sports is girls soccer. And they don't have the oversight that football does. So we suspect that the rate is actually higher in soccer. So this is not really just an American problem, right? We know that there are sports played around the world that involve injury that we don't play. So let's look at other sports and other European sports or other non-American sports. So horse racing has, per 1,000 player hours, 95 concussions. That's a lot. How about other sports like rugby or ice hockey? You'll see that the rate of concussion in these professional sports is actually higher than American professional football. So that's shocking. So the rate of concussion around the world is quite high. So how do we diagnose this? It's a problem. We rely almost entirely on self-report. There's no biomarker, there's no blood test, there's no imaging study that we can do to diagnose a concussion. So we rely on this athlete who's motivated to lie to me, right? To lie to you also. And we rely on them to tell us what their symptoms are so we can make the diagnosis. Some athletes will, and some students will lie towards hyperbole. Oh my God, I can't even make it through my day. Oh my God, I can't even wake up in the morning and get to work, get to school, get to breakfast. And some athletes will minimize their symptoms. Some students will minimize their symptoms. So it's a problem across the spectrum. So how do we define it? The definition of concussion, if you've ever looked it up, is 169 words. I don't know, but if a definition is 169 words, I can't memorize it. I'm not that smart. I can't memorize 169 words and just rattle them off. But here's the key thoughts. It's a direct blow to the head or the body. It results in rapid, short-lived, typically, impairment in neurologic symptoms. There is a population, a subset of people who will have persistent symptoms, and we can talk about why. It resolves without really any intervention except for time, so spontaneously, and it's a functional injury, which means that any imaging study, any standard imaging study, like CT scans, will be normal. So a lot of people will say, well, what did your CT scan show? It doesn't really matter because it's a functional injury, right? And so it results in 4 categories of symptoms, classically. So you'll have emotional symptoms, crying too much, laughing too much. You'll have somatic symptoms such as headaches, that's the most common, nausea, vomiting. You'll see a lot of kids be very, very tired, and some will have insomnia. And you'll have cognitive symptoms like trouble concentrating. And we've all seen this, right? So we say it's a functional injury with individual expression. Each child, each patient, each athlete will manifest their symptoms in different ways. Some will be more cognitive symptoms, some will be more somatic symptoms. They'll manifest their symptoms in a variety of ways. And so we kind of have to be a detective when we talk to these patients and try to figure out if they are concussed. We have to see what their symptoms are, we have to see what their triggers are, we have to see what makes them better. And in the busy emergency department, we don't have the time to spend 20 or 30 minutes to try to tease this all out, which is why quite often we'll say, I think you're concussed, you're pulled from your sport, we'll give you a little break from school, go see a specialist who's going to have more time to tease all this out. So how do we explain this to our patients, and how do we explain this to our athletes? How do we explain this to their families? How do we explain this to the kids? So the way I explain a concussion is cotton candy on a stick. So we talk about the brainstem and the spinal cord as having a specific density. And we talk about the brain. I say the brain is sort of like jello. We've all seen this on TV, some of us in anatomy lab. And you can poke it with your finger, and it's kind of jello-like. And so when you have an injury, the jello-like substance, your brain, will twist upon its brainstem. And that's what causes a concussion. And so is that true? So here's your normal brain. We have the fibers emanating from the corpus callosum lit up here. It's a specialized study, a specialized imaging technique that they can do out in Utah. And we look at a normal brain versus a concussed brain. So you see how on the normal side it's beautifully fanned out. See how beautiful that is? And on the concussed brain, you see it's not so beautiful. There's defects all over the place. That's what a concussion is. So what's happening? Something's happening to our axons. And it took lots and lots of research to figure out what's going on. And we think we have an idea. And I'll share this with you. So here's our brain. And we think there are 5 mechanisms of pathology. And when we look at patients who have persistent symptoms and look at different imaging techniques, we're able to identify some of these pathologies. So first, this is the one that gets the most we talk about the most, the abnormally deposited tau protein, right? We talk about this. This is the basis of chronic traumatic encephalopathy, the basis of CTE. And when you have this abnormally deposited tau protein, you're going to destabilize the microtubules that support the axons. And so this is the first thing that we talk about. The second is we have alterations in myelin. Myelin being the superconductor for our thoughts and our sensations. If there's alterations, we're going to slow down our cognitive ability. The third is we've noticed atrophy in the hippocampus and thalamus, which affects our cognition. The fourth is changes in perfusion. We don't actually know the clinical relevance of this. This is sort of one of the newer things that we've noticed. But after an injury, we're noticing that there's changes in the amount of blood flow to the injured areas and the rest of the brain. But like I said, we're not really sure what the meaning of this is. And finally, we have delayed connectivity. So it's taking forever for thoughts to get from one end of the brain to the other. And these problems are worse in women than they are in men. We've noticed that the women have far greater symptoms than the boys do. So what happens with a concussion? You have this need for blood. You have this need for healing to happen in your brain. But then the children are trying to go to school, trying to live their lives. And so there's an imbalance, right? So you're trying to do something, you don't have the resources to do it, and that's when symptoms become manifest. So how do I think about this? I think about this like tokens in the bank. So a child will say to me, I've got nationals, I've got the SATs, I've got a test, I have a party, I have my prom, can I go? And I say to them, think of it like money in the bank. The minute you hit your head, you ran out of money. You've used up all of your money in the bank, you've got nothing. And every time you rest and you go through a symptom-free period, you're putting more money in the bank, more tokens in the bank. And anytime you do something, you're running out of money. You're using up money. Some things cost more than other things. For example, going to the prom, watching Iron Man, watching anything with too much stimulation is going to use up a lot of money. Sitting there and knitting me a scarf is going to take up very few tokens and is a nice way to waste your time. I have a lot of scarves. And so, a lot of coloring, a lot of embroidery, and so a lot of cookies. And so I tell the kids to do something that doesn't take a lot of energy. And that's how we can get better, and take the time to do it. So concussion is a process, not an event. So when you break a bone, right, it happens. Everybody knows, everybody on the field, everybody around you knows it happened. You go to the ER, you get an x-ray, you have a diagnosis, everybody can see you walking around with your cast, you get the appropriate amount of empathy from all of your peers. But a concussion, what does that look like? You go to school, you go to university, you sit in the back of the class because there's too much stimulation going on. You sit in the back of the class at your high school, and you look what? Your eyes are glazed over, you're falling asleep, you don't look that engaged, you look kind of high. And so often teachers will call me and say, I think my student is high, not concussed. It's a trick, they're actually concussed. So what's the goals of the treatment? We say the number one goal, of course, is to protect the vulnerability of the brain. And this is the basis for rest, because like I said, the more periods you have with no symptoms, the more tokens you'll build up so you can do other things. So we say, this pendulum has swung really far. There are some schools, there are some people, there are some physicians who still say what we call cocoon therapy. We put the kids in a room under a blanket, and you can come out to pee, eat, and shower, and that's it. The rest of the time, you're under a cover. And if you're a professional athlete, that's often what happens because they have one job, and that is to go play their sport. But we find that kids become quite depressed when we make them do that. And we also find it prolongs symptoms. And so we let them go out and do things, engage in school, engage in their social networks. But we also ask for quite a bit of rest. So it's hard, though, in a school setting, to balance the medical needs and the academic needs of a student. And right now, we're not even talking about returning to sport. We're just talking about going back to school first and having a lot of support so the kids can go back to school, which means you go to school maybe a half a day, which means when it's the change between classes, instead of walking through the halls when there's all this noise, we say leave class a few minutes early, walk through the halls to your next class when it's quiet, and then go to your next class. That way you avoid all that stimulation. We say don't attend classes where they use computers or smart boards because we know that's a lot of stimulation. We have programs that will take your textbook and read it to you, so that way you don't have to read the textbook. And that way you can just listen to it and not be so stimulated. So we have all these ways to try to support our recovering concussed student. And so the question of the day, always, the question from every parent is what? How long is my kid going to be out, and can they play in the next game? And can we hurry this up? And so I had a very well-known hockey family come see me in clinic one time, and the son was concussed. And I went through my whole, here's what a concussion is, here's how it's going to take to get better. I have no idea how long it's going to take, but here's what I think, based on what you've told me. And the father was very unhappy with my answer. So he went to go hit me because he wanted his kid to play in states next weekend. And it was my job to clear his kid so his kid could go play. And so there was a little hole in the wall, which I framed. I put a little frame around that to remind me not to give in to peer pressure. So what is it? What are the things that prolong recovery? So age. We know that the age of the athlete will prolong recovery. So if we took helmets that were fitted with sensors, and we looked at the amount of force that the athlete sustains or is subject to, if I took the same amount of force between 3 classes of athletes, if I took a professional athlete, he would take 3 to 5 days to get better. If I took a college athlete, same amount of force, that would take 5 to 7 days, same amount of force. And if I took a youth athlete, same amount of force, 10 to 14 days. So with just the age is going to prolong recovery. How about a concussion history? We know that kids who have had 3 or more concussions will have delayed recovery. We know that they will have a more severe on-field presentation of their symptoms. And we know that they're going to be requiring a lot more support. How about the sex? I sort of alluded to this earlier. Women in general have a lower threshold to concussion, so it takes less for them to be concussed. And they have a longer recovery, also requiring more support, and other comorbid conditions. So, as we heard earlier, this is the age of mental illness, especially in adolescence. Any sort of mental illness is going to prolong recovery. Any history of migraines is going to prolong recovery. They're going to be far more symptomatic than the person with no comorbid conditions. And so, like I said, younger athletes take longer to heal. Recovery confounders, so a history of 3 or more concussions. So that's the magic number, some would say. Every parent wants to know, my child's had 2 concussions, my child's had 1 concussion, how bad do you think they're going to be? And I suppose that 3 is a good place to start, because we know that with 3 concussions, you're going to have more symptoms. Boys and girls, in fact, are different. And there's lots of studies that are showing now that girls just don't do as well with concussions. And like I said, the comorbid conditions. And we believe this is because when you have a history of mental illness or migraine headaches, you just have less tokens in the bank. So it just takes longer for you to get better. And remember, the goal of all of our concussion care is to put everybody on the same page, to balance the needs of the child, to try. We know that the pendulum has swung too far. We spend far too much time talking about concussion. We spend so many dollars researching concussion. We hope that this will come back, and we will find a way to balance the needs, both academic and non-academic, of our youth athletes. Thank you.
Thank you so much, Neha. You've definitely broadened our understanding of concussion and really making us think a little bit that step further about how we can better support children and adolescents with concussion, even if it wasn't from playing American football. So we've got a few comments and questions from Twitter, I believe, Danny.
So lots of comments. A couple of questions for you. So the first one says, in the States, sports in high schools are the path to a full university scholarship and possibly even the pros, with massive amounts of money attached to all of these. And then it says, rugby authorities have recently moved to fining teams for breaching concussion rules. Do you think that fines for high schools that breach concussion rules would help break the cycle of hiding concussions at a young age? And that's from Napt from Norwich.
I think that fining high schools is an interesting thought. The question is, who's going to do this? Who's going to enforce this, right? Because the coaches are not necessarily going to enforce it. Referees, maybe, but then we would have to start educating the referees to diagnose concussions. The high schools don't necessarily have the funds to have a sideline physician who's going to diagnose the concussion. So I don't think that fining is the way to go. I prefer less carrot, or less stick and more carrot.
Lovely. And then we have another question here from Claire Salter, who says, so the beginning of the concussion, how soon can we expect to see the symptoms? Parents are always asking if they should wake their children from sleep to check they're okay. Is letting them sleep better?
So this is a good question, actually. So most concussion symptoms don't actually appear right away, right? So if I got hit in the head, of course it's going to hurt. I just got hit in the head, right? And so it's hard to say that's my concussion. So I have to do something that's going to stress me to see how I react to it. So for example, engaging with my family at dinner or watching TV, and let's just see if my symptoms precipitate. So it often can take up to 24 to 72 hours for symptoms to manifest. And so as far as waking the child up to see if they're okay, if the child presents to the emergency department and you've ruled out a bleed or more severe injury by whatever method that we rule it out. If we've ruled it out, there's no reason to wake up the child every few minutes, few hours to see if they're okay, because we already know they're okay. We already know they're not bleeding. And so waking the child up while they're trying to build up their tokens is the wrong way to go.
Great. And then one last one here from Becky Singer, who says, on first or subsequent presentations of concussion, and particularly sports playing kids, is it worth mentioning the risk of CTE and the effects of repeated head trauma?
I think that it's worth mentioning just in general that we have known long-term cognitive deficits from repeated head trauma, and among them possibly CTE, and among them possibly Alzheimer's. And we have all these ideas, and we know that things happen long-term, especially in the cognitive world, and stop there.
We might take one or two questions from the audience, so if you put your hand up, one of the roving mics will come to you. I actually had a question, Neha. We were talking a little bit about this beforehand. When I see a kid in ED and they've had a head injury and they've had a vomit, but we think that they're safe, they don't need a CT, and we've observed them, I often tell them they've got a concussion and I label them. Does having a vomit after a head injury mean that the child has a concussion, or do you keep it as part of that initial fallout from the injury?
So there's 21 symptoms that can happen after a concussion. Vomiting is one of them. Headache, we talked about. Nausea, imbalance. We talked about some of the emotional things. So just because you vomit doesn't necessarily mean you have a concussion. If you lose consciousness, yes, you have a concussion. But otherwise, any of these 21 symptoms does not necessarily mean that you have a concussion. But only 10% of concussions lose consciousness. So that's not something to hang your hat on.
We've got a question from your daughter, Zia.
Oh my God. No, you do not have to hit your head in order to get a concussion.
Wonderful. We've got one more, sorry, Ben, just in the middle. Pass the parcel down the...
Hi, thanks. You talked about the cocoon syndrome that we used to tell people rest, 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 and recently I've heard that there should be some level of activity that speeds recovery. Mm-hmm. And what level of activity should a teen or adolescent be undergoing to try and speed recovery?
So we talked about rest to increase the number of tokens. So let's use my analogy of the tokens in the bank, okay? So we talk about rest to increase the number of tokens. If you can't even make it 20 minutes, so let's say you wake up in the morning, you're feeling great. If you can't even make it 20 minutes to have symptoms, then activity is not going to do anything. You have to be able to make it a little bit of the day with no symptoms. Once you're able to survive a couple of hours with no symptoms, like headache, nausea, vomiting, blurry vision, anything, then we talk about increasing your heart rate with some activity. So either going to school, we typically do a bicycle protocol, and we have the kids ride a bike for 10 minutes just to see if that precipitates symptoms. And we found that if we can increase their heart rate early on, and not have symptoms, they actually recover quicker. So that's absolutely true, and we do this we're pretty generous with how much we let people increase their activity as long as they can tolerate it.
Fantastic. Well, thank you very much again, Neha.